I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good afternoon, everyone, and welcome to our first North Carolina Governor's Working Group on Veteran Service Members and their families. Today is January 28, 2021. We are glad to see you all here with us and hope to have you some good information today. Please remember you can register for email updates at ncgwg.org. You can always join us by live stream here on Facebook.com/GOVINST. If you will like the Governor's Institute Facebook page, you will get updates on when they are going live. And to watch closed captioning, please just click on the link there at carolinascaptioning.onecap app. And our meeting agenda and minutes are always at ncgwg.org, as well as a copy of the program after we are completed. Today, we're going to talk about our vaccine training, COVID-19 vaccine training and inoculation. And first up, I would like to introduce Lieutenant General Walter E. Gaskin, the new Secretary for the North Carolina Department of Military and Veterans Affairs. Martin Falls, Deputy Secretary of the North Carolina Department of Military and Veterans Affairs, with updates from our agency. Okay, they may be having some technical difficulties. What's happening now in the state, we're talking about COVID-19 vaccines, budget development, and of course, welcoming Secretary Gaskin. We got to meet him yesterday with our first Veterans Affairs Commission meeting for 2021. It is scholarship season.
You hear me, Crystal?
I sure can, and there is Secretary Martin Falls.
Amazing. Technology works if you know how to work it. And I'm the one that don't know how to work it. So please excuse me. But, you know, it's a great honor and a pleasure today to introduce the new chairman of the Governor's Working Group, Secretary Walter Gaskin. He goes many names: retired Lieutenant General, Marine, father, husband, veteran, you name it. He's been there, he's done it. But Secretary Gaskin, you know, he come to us with a long 39-year military career in the Marine Corps, attaining the rank of Lieutenant General before he retired. Couple highlights on there. You know, he was at NATO, his last assignment as a 3-star general. Prior to that, he was the 2nd MEF commander at Camp Lejeune, and also he commanded the 2nd Marine Expeditionary Force in Iraq as a 2-star general. But more importantly, he is a friend and a veteran, and we welcome him with open arms. And I know everyone on this on the Governor's Working Group will do the same. Now, he's been drinking from a fire hose, as everyone knows, for the last week, coming in a new position. And I know he's very proud to be here. And I'd like for him to say a few words before we do get started on our briefings, Crystal. And I'll turn it to Secretary Gaskin right now.
First of all, let me thank everyone for being here, and because I consider it an honor, because it gives me the opportunity to advocate for and support all things military and veterans. And so with that, I just want to say that we're here to continue the great work that you've already done. I'm on board, all in, and ready to go. Thank you very much.
Thank you, sir. And with that, I'll go ahead and start our brief and welcome to 2021 with the 2020 in our rearview mirror. And it's going to be a bigger, better year than ever. So we're looking for good things. And the first item I'll say there, the COVID-19 vaccinations, they're underway. We have completed the first round in all of our nursing homes in the state. So we are extremely pleased with that. Now we're looking for round 2 of them and encourage everyone to get out and get the vaccine as quick as possible. Let's get the vaccine and get our work open back up again. Second thing is, the state operates on the July through June budget, so we are heavily engaged right now in budget development of the items that we need to be successful in the military and the veterans arena in the next 2 years with that budget development. And I'll say Secretary Gaskin is on board. He is, as I said, he's drinking from the fire hose, but you know what? He can handle it. So I have no doubt that we got a great boss and looking forward to this. Next slide, please. And I'll say what's coming out next. Well, next is our Children of Wartime Veterans. We offer that veteran scholarship to the children of wartime veterans. Every year we do that, and we have begun that process for selection of those children for the 21-22 school season. So we're heavily involved in that one also. Kernersville is right on the edge of completion. We look forward to being completed sometime this summer, but we're what, Terry, 70% completed?
Almost 80.
Almost 80% completed right now. And whenever that occurs, we're naturally going to have a grand opening there. So there'll be more to come on that. Our training, last year, we were put into the program that we're going to continue our education for our veteran service officers. We did that through virtual means. There again, initiative, ingenuity, and resiliency overcame the issue of how do we train? Well, we learned we can do it virtually. And I know that's not the preferred method, but it's the best method we have during this time of pandemic that we're currently experiencing. So we're continuing that again in 2021. So we're looking forward to that, getting that rolled out for all of our veteran service officers throughout the state. And then next slide, Crystal. The viewer takeaways, we're still in this pandemic state. And once again, the governor and everyone encourages vaccination of the COVID-19. So please, when it's available, take that vaccination. Let's get back to a normalcy. Now we're going to continue our business in the modified delivery methods that we're doing, not to preferred, but it is a way of getting the work done and taking care of our veterans and the military out there. So we're going to continue that method. And again, more to come on the Kernersville nearing its completion. And once that is completed, you'll be notified, and we'll have a large outdoor gathering, hopefully by then, and we'll have a large time. So thank you, barring any questions. Hearing none, thank you, Crystal.
Thank you as always. And I just want to add to that, the North Carolina Department of Military and Veterans Affairs has 12 veteran service centers across the state in one of 4 regions. Please go to milvets, milvets.nc.gov under services and benefits to find your nearest state veteran service center or your county veteran service officer. Those individuals are highly trained and ready to help serve you in identifying and navigating the federal benefits that are available to you and your family. Thank you so much, Mr. Falls. Next up, co-chair is Steph Young, the acting director at the VA Mid-Atlantic Healthcare Network. Steph was the previous director at the Asheville VA Medical Center, and so Vision 6 is really lucky to have her. I know her work, and I know how passionate she is about helping serve our veterans. Welcome, today, Steph Young.
Thank you, Crystal. Appreciate that. So just to kind of give you some updates about the VA and VISN leadership. So as part of the transition to the new administration, President Biden has nominated Dennis McDonough to become the next VA secretary. So we'll wait to see how that goes. Until that nomination is confirmed, we have Dat Tran, who's occupying the role of the acting VA secretary. There's also a whole slew of national level changes in the interim. It's really too numerous to list right now, but lots of changes going on. Just for local significance, so as you mentioned, I'm acting here since Ms. Seekins retired. So I'm acting VISN director. So my normal position is the director of the Western North Carolina VA healthcare system, the Charles George in Asheville. So while I'm here, Dr. Colleen No is the acting medical center director at Charles George. Dr. No, her normal position is the AD, the associate director at Johnson City in Tennessee. So she's coming over to help us at Charles George. We also have another good announcement. Dr. Takisa Simmons was sworn in last Tuesday as the new full-time director at the Hampton VA Medical Center. Dr. Simmons has been at Hampton as associate director since 2017. And also just some for leadership here at the VISN, Dr. Mary Parker. She's working as the acting chief medical officer as we recruit that position also. She was in this post officially. She came over from Durham VA in November. You'll hear from her later because she's going to brief us about our efforts here in VISN 6 on vaccinations. So just some moving forward vaccine and COVID-19 items for discussion. So all of our sites are demonstrating their ability to operate safely in clinical practice with regard to patient safety and staff safety. Also, during the COVID pandemic, lots of phases of reopening and our different sites are in different phases. We have a VISN 6 moving forward task force chair, and that's Dr. Brian Hayes. He reports that 2 sites, both Durham and Salem, are at phase 3. And that really enables those 2 sites to incrementally increase outpatient face-to-face care and other services. And they've also begun opening to still limited visitations. All the other sites are still in phase 2, meaning that they've been slowly increasing outpatient face-to-face care. And they're really making decisions on some elective surgeries requiring hospital admissions. And that depends on what's happening in their inpatient census with COVID positives. No sites have been able to move up in their phases due to the increase in COVID cases in the community. As the vaccine continues to roll out, increases may continue to occur across the VISN 6 sites. Also like to point out that vaccine information can be found on the VISN VA's website. It's the link, it's the www.va.gov, healthcare COVID-19 vaccine. And remember that veterans do not need an account to sign up for information. And we'll make sure that Mary's gonna give some more detailed information about vaccines later. And I'm sure that's gonna be the hot topic. Next slide is about caregiver support. Since October 1st expansion, we received over 3,600 applications. VISN 6 eligibility appeals teams nationally as one of the most efficient teams to process these caregiver applications. They're doing really, really well, making sure that these applications move on in the process. We're also proud to offer COVID-19 vaccine and testing for enrolled caregivers at the VA facilities where the veteran receives care. We just received that approval memo not that very long ago. Also, VA has contracted with Fitbit to initially provide 10,000 eligible veterans, caregivers, and VA staff a 1-year free membership to Fitbit Premium. And even with COVID, we want to make sure that people don't forget about the flu shot. We have seen a decrease in flu cases this year due to increased mask usage, social distancing, and also frequent hand washing. If you're planning to get a shot, and you cannot receive other vaccines like the flu shot within 2 weeks of receiving the COVID vaccine. So remember that there's got to be that 2-week window from getting vaccine. So you can't get the flu one day and COVID the next day. And Mary can also review that when she does her vaccine updates. Another subject topic would be veteran debt and overpayments. So we're aware of the executive order that the VA has implemented and the date that it was signed. The veterans continue restatements or notices, but they should understand that we are not demanding payment. However, if they choose so, they can continue to make payments on that. They can also contact, for any debts or overpayments, contact their local facility to discuss that, payment options. And just remember too, for February, it's cancer awareness and heart health awareness. Crystal, that's all my updates. Do you have, anybody have any questions or comments for me?
Thank you so much for your updates. We're glad to have you there. I'm going to be reaching out for a subject matter expert on the new caregiver program, so we can get some training for our BSOs in that program. So I'll talk to you soon. Next up, we have Mark Belos, the director for the Winston-Salem VA Regional Office. And Mark, it is good to see you. Welcome.
Thanks, Crystal. It's great to join you all again today. I'm excited to be here. It's great to have a brand new year of the Governor's Working Group. Secretary Gaskin, I want to welcome you and look forward to working with you in the upcoming year. I know Steph Young mentioned some of the VA leadership changes. I do want to mention that we've had a change at the top of the Veterans Benefits Administration. Thomas Murphy, who is the Northeast District Director, has been moved into the position of acting Undersecretary for Benefits, and he will remain in that position until an Undersecretary for Benefits is nominated and then confirmed. So Tom, prior to serving as the Northeast District Director, was at a point in the past the acting Undersecretary for Benefits before our last permanent Undersecretary was installed. So Mr. Murphy's going back into that position, and I could tell you, knowing him for a long time, he cares deeply about veterans, making sure that we provide timely and quality services to all. Our operating status in the regional office in Winston-Salem, which covers all of North Carolina, is we are in phase 2. And what that means is we are open to the public by appointment. We have been in this stage for several months now. If you go to our website, you will be able to book an appointment to come in and see one of our counselors, whether it's to talk about benefits or anything else regarding VA benefits. What we will do is we will, if you book an appointment, we'll give you a call. We're finding that probably about 65 to 75% of the folks that book an appointment really don't have to come in and see us. We can handle your questions, your concerns, or any other needs that you have over the phone. That's great. It creates a safe environment and keeps everybody from having to travel. But for those of you that are coming into the office for an appointment with one of our folks, there is a requirement that you wear a mask. And that you will be screened for safety considerations. And I want to ensure all of you that we have a full-time cleaning staff on board so that the facility is clean and sanitary when you arrive. All of our folks that will be talking to you will also be wearing masks. We're also open for hearings. Some of you may have BVA hearings or local hearings with the regional office, and we're open and have been scheduling those for the past couple months. Last topic on this slide is exams. As part of the disability claims process, many veterans have to go through a disability exam. Over the past summer, because of the pandemic, those exam appointments were shut down. We're not doing exams. We currently are open. We are examining veterans through our contract examiner, and that is helping to move a lot of the claims along quickly. We anticipate by this summer we'll be fully caught up in those examinations that were backlogged and be able to get decisions out on claims. Next slide, Crystal. What's coming up next? We're currently not doing face-to-face outreach events, big outreach events around the state. We are very hopeful as this year progresses and vaccinations occur and things get better that we'll be able to continue those. We have a very robust outreach program around the state, targeting many areas, and we hope that soon we'll be able to get back to normal. In the interim, we are doing virtual outreach events. We have done dozens of these over the past year. We are open if your organization has a need for veterans to hear about the services we offer in the Veterans Benefits Administration. You can reach out to us and we'd be glad to conduct a virtual outreach event. We're continuing our program of monthly education events on different types of VA benefits. Our next event is scheduled toward the end of February, and it's going to be on survivor benefits. If you check the website on the screen, on the bottom, you'll be able to see a list of upcoming virtual outreach events that we will be participating in and how to join those events. And that link will also get you to the site if you need to get in touch with us to schedule a appointment to see somebody or talk to somebody on the phone. Just some final takeaways. Despite COVID, despite the pandemic, we continue and have continued to employ our to employ our employees in innovative ways to serve veterans. We are open for business, serving folks, and currently continuing to move forward in assisting veterans. We have also been operating at full capacity since last March. All of our employees that can telework are teleworking and continuing to serve veterans from their homes. So we continue to move forward, and I'm glad to say that all of our employees throughout the whole last 12 months have been fully employed and committed and servicing veterans. And I think, Crystal, that's my last slide, and I'll hand it back to you. Thanks.
Thank you so much. And I want to extend appreciation to you and your public contact team who are going to do some training for us this year, beginning in February. So we really appreciate your support.
Absolutely, anytime.
Next, we have Dr. Michelle Laws from the Department of Health and Human Services. Dr. Laws. Do we know if Dr. Laws is with us or is someone standing in for her? Jeff Smith.
All right. Well, apparently something has gotten in the way of Dr. Laws being able to join us today. And so I will cover for her at a moment's notice here. First thing we want to point out is the critical nature of community spread and the way these things are happening in North Carolina with COVID-19. What do we have? Something like 86 counties are now critical. This is due to folks not doing what they're supposed to do, following the 3 W's staying separated, washing their hands, and wearing masks. If we go to the next slide, please. You can see North Carolina's COVID-19 response to date. And we are working diligently with the existing healthcare providers and the federal government to get out as many doses as we can every day to as many folks as we can so that we can qualify for more in basically what is a reimbursement type situation. Secretary Cohen briefed the state yesterday that we have already received an increase in our allotment. It's a small increase. I believe it was 14%, but every bit helps. If we go to the next slide, please, ma'am, you will see what our current plan is for the vaccination schedules, the percent of doses administered, and through these various groups. Group 1, healthcare workers and long care staff and residents. So we see right there that for the providers, we've gotten 69% of arrived doses administered for total doses. Obviously, we have to balance this and hold some back so we make sure we have doses. I know that the federal government has promised to give us a much better rollout schedule that'll let us plan 3 weeks in advance. And Secretary Cohen and the vaccine team are busy working on that. Priorities, what is coming up next? We are working with many of our community partners to find a way to use the homeless veteran stand downs in the spring to provide COVID vaccinations for homeless veterans and get them into the various systems, whether it is with VA or state healthcare. We are looking forward to kicking off the Ask the Question campaign. Have you or a loved one ever served in the military? And we continue ongoing assessments within DHHS and our partners in the LEMCO system to see how we can best serve our veterans. As Mr. Belos commented, innovation is the word of the day this year. And so we continue to do our very best to advance in those areas. Next slide, please. As this pandemic wears down, everyone is feeling slightly overwhelmed and tired, obviously. We have several programs for folks around the state of North Carolina. We have our Hope for NC helpline. That'll connect you with additional mental health and resilience supports, as you can see. And that number is 1-855-587-3463. It's open 24 hours a day, 7 days a week. To the left, on the left side of the screen, many other resources available through the division and our partners. Please, we also have an upcoming series in conjunction with UNC-TV that we've been working on. It's called Get the Scoop on Managing Stress. And those are a series of virtual town halls. Please visit UNC-TV or DHHS websites for those times. And that would conclude our Division of Mental Health updates. Thank you so much.
Thank you, Jeff. We appreciate you shooting from the hip there, and that was excellent coverage. Next up, for Workforce Solutions, we have Victor Glover standing in for our co-chair, Mark Edmonds. Welcome, Victor.
Thank you. Good afternoon. On behalf of Department of Commerce, Division of Workforce Solutions, Mark Edmonds, who is our Chief Operations Officer, and Assistant Secretary Jessica Engler, we'd like to welcome you, Secretary Gaskins, and we're just happy to give this report to everyone. It's been a few days since we've all gotten together. But on behalf of Division of Workforce Solutions, we have 88 career centers across the state of North Carolina. And of the 88 career centers, 37 of those centers are closed because of COVID. But we continue to adapt to the virtual services that we're providing during the pandemic. We are still encouraging all people to use the virtual and the remote services as much as possible, calling, emailing the career centers for assistance. Where they are opened, the centers are maintaining public health and safety guidelines to protect the personal equipment and social distancing. One of the other things that we're right now is that we're doing drive-through job fairs. We're working with various drive out there. It started out was kind of back in June and July, but it's become across our career, our through the job fairs. We also provide access to hire. We advertise employees on our website, and we also have employers locate labor market tools. Even doing explain the job drive through job fair. You can NC Works staff for guidance when you reach them via email. Next slide, please. Also, we're working with one of our commerce, North Carolina for military. They are all virtual events. We just had an event yesterday that was quite successful. I haven't coordinated with Sean to find out what the results were, but the virtual events, again, something that was started last year, picking up steam, and we're doing quite well working with the transitioning service members, veterans, and military spouse. And our next slide will give you our contact information. And as usual, these slides will be available to you after today's events. You can go into NC, you can go into the website and pull the information up for any further resources that we may be able to provide for you. Thank you very much.
Thank you so much, Victor. We appreciate you being with us today. Next up, we have a very special presentation, and I hope that you all enjoy.
The North Carolina Governor's Working Group on Veterans, Service Members, and their Families has deep roots in the Tar Heel State going back more than a decade. Today, it offers a home for the dozens of groups in the state focused on improving veterans' lives and provides a canopy of relief for hundreds of thousands of North Carolina vets. The GWG is a living, breathing apparatus of service, providing a space for veteran advocates to find new ways to better serve those who have served our country. The first seed of this awesome idea was planted in 2006. Among the founders, Flo Stein, Dr. Harold Cudler, Dr. Wei Li Fang, and Dr. Mike Lancaster. Over the next few years, the roots of what we now know as the GWG began to take hold, and by the early 2010s, that seed had grown into a sturdy sapling. Heavy-hitting state agencies, such as the Department of Health and Human Services and the Department of Commerce, had come on board. The Department of Veterans Affairs was fully engaged, and nonprofit groups from across the state were.
I apologize, everyone. I'm going to restart that video because you missed the first part. Apologies, some technical difficulties. We are still learning in this virtual environment.
The North Carolina Governor's Working Group on Veterans, Service Members, and their Families has deep roots in the Tar Heel State going back more than a decade. Today, it offers a home for the dozens of groups in the state focused on improving veterans' lives and provides a canopy of relief for hundreds of thousands of North Carolina vets. The GWG is a living, breathing apparatus of service, providing a space for veteran advocates to find new ways to better serve those who have served our country. The first seed of this awesome idea was planted in 2006. Among the founders, Flo Stein, Dr. Harold Cudler, Dr. Wei Li Fang, and Dr. Mike Lancaster. Over the next few years, the roots of what we now know as the GWG began to take hold, and by the early 2010s, that seed had grown into a sturdy sapling. Heavy-hitting state agencies, such as the Department of Health and Human Services and the Department of Commerce, had come on board. The Department of Veterans Affairs was fully engaged, and nonprofit groups from across the state were getting to know each other, meeting, and finding ways to work together to make veterans' lives better. In 2013, NC for Military Employment was created, NC for Me, an offshoot of the Department of Commerce. In 2014, the organization officially became a working group, before it had been a focus group, and a number of today's mainstay service providers got their start, among them Operation Home, a group committed to ending veteran homelessness, NC Strive, which helps address veterans' educational needs. Also, the first Women's Veterans Summit and Expo was held in 2014, and Veterans Experience Action Centers were established around the state. The following year, another group that's now indispensable was born out of the GWG, NC Serves, which today serves more than 13,000 veterans in 80 North Carolina counties. Also in 2015, the state doubled down on its commitment to vets, creating the Department of Military and Veterans Affairs, which promptly joined the GWG. A large part of the group's success can be traced to its unwavering commitment to key veteran issues, like curbing veteran suicide and ending veteran homelessness. Those critical missions were at the core of the seed planted in 2006 and remain central today. In 2012 and again in 2015, the group published statewide suicide reduction and prevention plans.
These are a lot of good guys, but if they're sitting at home,
Over the past 3 years, the GWG has become a showcase for veteran-oriented videos and digital media outreach.
I am sober.
Including an original series called Words to Live By. Battle-hardened veterans speaking directly to other vets, encouraging strength and resilience. Today, the GWG meets once a month to highlight pressing veteran issues, explore new solutions to veteran problems and challenges, and build relationships that turn ideas into action. Representatives from dozens of groups across the state make the monthly trek to Raleigh for the 2-hour meeting. Many more watch online. Each meeting is streamed live, offers closed captioning, and allows for viewer engagement. New ideas like the Governor's Challenge are introduced and given space to grow. Ideas like helpncvets.org are showcased and offered up to the group. Help NC Vets does just what it says, helps veterans and their families get connected to services in the state and connect with each other. Because of these and other efforts, veteran homelessness has turned a corner over the past decade. The veteran suicide rate in North Carolina is significantly lower than the national veteran suicide rate, and the Tar Heel State has boasted one of the lowest veteran suicide rates in the Southeast for the past several years. From its humble, passionate beginnings, the GWG has grown into a mighty tree of veteran support, and it's only getting stronger. Every year, the ground in which it's rooted gets richer and its branches grow longer. New fruits of service spring up, and more relief finds its way to North Carolina veterans and their families. The North Carolina Governor's Working Group can and should be a model for how to meet that mission around the country.
Wow. To say that I'm proud to be a part of this is just not enough. There are no words. Jeff, I know you're going to give accolades to those who helped develop that. And welcome Jeff Smith, again, Military and Veterans Program Liaison, Division of Mental Health and Substance Abuse Services. Thanks, Jeff.
Thank you so much for that kind introduction, Crystal. It's my pleasure to be here, and my pleasure to say welcome aboard to General Gaskin, and congratulations to Director Young. We are honored to be here with you and work in the same fight. So if we can go through and let's get to our first slide. I'll try and keep things moving along. Operation Home is one of those key offshoots that you saw. that has developed from the governor's working group. I'll admit it has been a struggle, hurting all of the disparate cats in veterans homelessness throughout the state, the many agencies and programs. But one of the shining stars in the efforts in North Carolina has been really coming out of the Veteran Services of the Carolinas and their efforts to rewrite the book on homeless veterans outreach. They run every major program for homeless veterans and even helped design a new one, which is mentioned right here, the Veterans Hope Program. They've been doing great work as well with the HVRP program. And, you know, especially with the weather being as foul as it is out there, please think about homeless veterans. Think about how you can help them. We have plenty of places with warm beds for them. Let's get out and extend them a hand and let them find some place to recover. Next slide, please, ma'am. All right, so we have NC Strive, and we have just finished working on the agenda for this year, which you can see. I'll briefly go through. We've got one in February with Appalachian State and Cape Fear Community College working on student veterans transition. Our March event will be working on student veterans employment, focused here with our friends at Wake Tech and NC State University as well. The April episode will be on student veterans whole health and wellness from the folks in Charlotte at Central Piedmont Community College. And again, in the month of May, we'll be headed down to Charlotte to speak with the folks from Johnson C. Smith University on student veterans educational resources. We are doing this in conjunction with PBS UNC-TV, formerly UNC-TV. Now it's PBS NC. So please keep an eye out for those. And the link is on the Governor's Working Group website, as are all these links. We are really excited to finally be able to put a serious effort into our Ask the Question campaign. The supplies have been delivered. We are working with folks in major healthcare systems in the state to pilot this in conjunction with some work that researchers at Duke are doing into how effectively the community reaches out to veterans and provides them links to the specialized services and care that they have earned. This campaign is directly intended to drive support for our governor's challenge to prevent veterans suicide. And on the right side of your screen, you will see the cover of the toolkit that Crystal Miller spent almost all of last year working with our extended team to put together. This allows communities to build grassroots enterprises to help us continue to lower the rate of veteran suicide in the state of North Carolina. Next slide, please. Our major identified goals for the campaign this year as we move forward are to identify and screen for risk, which Ask the Question is the key component in that. You have to ask so you get the answer. And then in that, we will be promoting connectedness and improving care transitions with more, better, warm handoffs. And also, last but not by no means least, and this really is the Gordian knot of veteran suicide, increasing lethal means safety. 70% of veteran suicides in North Carolina take place with a handgun. Coincidentally, 70% of veteran suicides involve some sort of self-medication with drugs or alcohol. So we are working on continuing to help Gary Kuna get the word out and the gun locks out and find ways to provide that crucial 5 to 10 minute buffer. All right. All of these strategies have been identified in conjunction with the folks at the SAMHSA's SMVF Technical Assistance Center. And additionally, the video that you just saw was requested by the White House Office of Suicide Prevention Prevents team after a state visit / audit of the work we are doing. They really had said that we seem to have a better handle on this than many, many other states. And the key to that really has been the Governor's Working Group and our close interpersonal relationships over many years, despite whatever agencies we may be at the time, this team has really continued to elevate the conversation on a national level. And with that, next slide, please. One of the things we really wanted to, as a team, especially from DHHS, not only welcome home our National Guard, many of them got home right as the end of the year was coming on. And I just wanted to make sure they knew how happy we are that they are home and that we are here for them. We have services. Additionally, I wanted to say thank you very much for your role in helping us get the vaccines distributed and administered. Always on the job. And so we just want to know that we are here for you as you are here for us. And with that, I believe that is the conclusion of my remarks for today. Crystal?
Thank you so much, Jeff. Always nice hearing from you. Next, we have a VSS training announcement. That's the Veteran Support Specialist Training that we offer. Is Dave Roddenberry from the Governor's Institute is going to tell us about what's happening with that this year. Dave, welcome.
Thank you, ma'am. So as Crystal mentioned, incredible news to share today. The Governor's Institute has assumed responsibility for delivering VSS throughout the state. That's a Veteran Support Specialist Training Program. If you're wondering what the heck VSS is, we've mentioned it a few times through the GWG, but it's a comprehensive training platform, and it's aimed at learners who serve veteran clients frequently. So we're talking about service officers processing benefit claims, higher education, points of contact working with families and vets for GI Bill assistance, nonprofits, anyone who touches veterans often. The goal is to develop our learners' understanding of commonly occurring veteran and military issues, physical health, emotional health, factors affecting their social determinants of health, and to really explain what treatment looks like from the veteran perspective, and offer some resolution techniques to kind of diffuse some of those more charged situations. This is all built around the peer support intervention and the coaching into care model. So the idea is to improve the way we communicate what treatment involves, promote adherence to treatment, and at the same time not becoming armchair clinicians. This program started way back in 2014 at Duke University as part of a larger grant from the GlaxoSmithKline North Carolina Foundation. It quickly evolved into a much broader program as the state VSOs and NCGWG, which was then the division rather than the department, really began to rally around this. Crystal, for one, has been a great supporter and proponent of the program, was part of our pilot cohort way back in 2015. The special thanks to Jeff Smith and DHHS, Department of Mental Health. That's a group that really saw the value in this training and have been wonderful partners in terms of promoting and finding funding to make this sustainable. The curriculum is made up of roughly 10 to 12 hours of original video and content. We work with guest faculties and subject matter experts to tailor the content to our learners, scripted and filmed each module, and it came together really well. It's presented in a hybrid synchronous asynchronous learning model. And so we'll have a live session, then a self-paced online learning. We come back together for a midpoint call, back to the online modules, and finally wrap up with a live session. We expect to launch the next cohort in late March, early April. We're tentatively planning on the last week of March. Unfortunately, due to COVID considerations, I had hoped that we'd had this thing licked by now, but we will actually end up breaking the live sessions up into two half-day virtual sessions. So this also means that our capacity for the spring cohort, it will be really limited. But I hope to squeeze another one in the fall. Personally, I'm super proud of this program. It literally was saving lives on day one. And for more information, go to vss.ncgwg.org. There's a place there where you can sign up for notifications, and we will let you know when enrollment opens and how to enroll. So thank you very much. I think we're doing NC Serve next, right?
We are. And so I'm going to stop sharing and let you have.
All right. Well, fingers crossed that I don't 11 Charlie this thing up.
Well, while you're pulling that up, I would just like to say, I know Brandon Wilson's on with us today. Several others who are in the initial planning stages of the VSS program. That is one of those things that we are all super proud of, just like the governor's working group. So proud to be a part of that and look forward to this year's cohort. And over to you, Mr. Roddenberry.
Thank you. Did I do that right? Or
you look good. Looks good.
Yeah, this is going well. So transitioning from VSS to NC Serves. I have a few folks with me. Donald Roos from VIA Health, Brandon Wilson from Veteran Services of the Carolinas, and Blake Bourne from VBH, Veteran Bridge Home in Charlotte, are all here, and talk to you a little bit about some kind of exciting developments in NC Serves. So NC Serves is a network of over 400 community-based organizations. It spans the state. It's operated by two major care coordination partners who you'll hear from in a moment at VSC and VBH. It presents a level of care that's unmatched. This is rooted in the idea, or even the finding, that the hardest part about transitioning isn't necessarily a single factor like employment or healthcare, but it's navigating this web of services that become available to us as veterans. NC Serves is connected to a larger ecosystem of interconnected communities, that form America Serves and other national networks. And the whole idea behind it is to transform the world of service and care coordination by giving our veterans and military families, a single point of contact and someone kind of helping them through and managing them through this process. The initiative started in 2015 in Charlotte, and quickly thereafter brought on the Central Network and then the Coastal Network, and finally Western, and I believe 2018. Today, we are super proud to announce that, having met and exceeded benchmarks for efficacy, sustainability, NC Serves is now entirely under local ownership. And so you may have noticed, if anybody has followed the change in my signature line, I have left the IVMF and joined the Governor's Institute, and I'm very fortunate to be able to stick with this work. That said, I do want to give Donald, Blake, and Brandon an opportunity to talk about a little bit about what local ownership means to them, and then we'll get into some of our roles and responsibilities in the next slide. So, Donald.
Sure. Thanks, Dave. Glad to be here. Glad to meet everyone. For those that don't know me, my name is Donald Roos. I'm the Senior Vice President of Provider Network Operations for VIA Health. And when you talk about local, that's what we are. We've been local in North Carolina, helping serve individuals with mental health, substance abuse, and intellectual developmental disabilities since the 70s as a local area authority and then local management agency, now a managed care organization, and in the state's future plans, hopefully a tailored plan operation. And so we're all about local. And above that, we're all about trying to support veterans. Historically, we've always wanted to make sure veterans in Western North Carolina receive the best possible care. And it's why we've always partnered with the NC-SURF system. So we're really excited now partnering with Jeff and Dave and Brandon and Blake and really talking about how we can take that work statewide and do better for our veterans statewide. So thank you for inviting me to the team, and we're proud and we're glad to be working together to make this happen.
Blake, you want to add anything about local ownership?
Yeah, thanks, Dave, and thanks, Donald. I'll echo and agree with what Donald shared. And on a personal front, it should be about local ownership because it's local ownership. It's local communities that send men and women into the military. We hand our best and our brightest to the military, ask them to defend our country, and we need to welcome them home. And what better way to do that than to do it in the context of where they live? Find the right companies, find the right nonprofits, find the right veterans and community members to make sure that they're cared for, and that our appreciation isn't just while they're in uniform, but once they're out of uniform as well. So you can't do that from afar. It's got to be inside of the context in the neighborhoods where they live. And we're honored to be a part of it and grateful for all the awesome partners that are in this work with us.
Brandon, anything to add from your side?
No, I think just to echo both those sentiments, I'm just really proud that we are outright in North Carolina. We own this now, and grateful for the IVMF and the vision that they had. But the fact that this completely belongs to North Carolina veterans and families is really important to, I think, all of us on this call. It is the North Carolina Governor's Working Group. Really want to highlight too the partnership with VIA Health. They've stepped into this space as an LMEMCO. Where some LMHCOs have not really leaned as forward into this work for our veterans community, and really grateful for VIA Health and Donald's partnership as we continue to grow this work.
Yep, thank you very much. And to Brandon's point, as IVMF is able to now take a bit of a step back in terms of a more active role in the NC-SURF network, we're really starting to take on a little bit of a new look with a lot of the same partners. So we can actually run down the list. I do want to, on Jeff's behalf, call out the way that this is entirely underpinned by DHHS, DMH. That, again, they've been huge champions in this work and have really driven this towards sustainability, and we're grateful for that. So we'll just go down the list here. Donald, do you want to talk a little bit about VIA's role and what you see going forward for NC-SURF?
Sure. Thanks again, Dave. I think the main thing, hopefully everyone in North Carolina sees at this point, is North Carolina is going through a huge reform in how we provide services in North Carolina. The department calls that, Medicaid transformation, and it's really even much bigger than Medicaid transformation. It's all about how do we really meet the needs of all of our citizens, not their just behavioral health needs, but their medical needs and their immediate needs, housing and employment, and all these critical things that really help support individuals have a healthy, well-being life. And this transformation is occurring across North Carolina. Come July, this July, 1.6 million Medicaid recipients are going to move into this managed care model in July. And our veterans are part of that conversation as we go forward. And so for VIA, we want to make sure that veterans don't get lost in that big transformation process either. We know that veterans are a specialized population that need specialized resources, that need people connecting with them, just like the VSS project you put out there, just an incredible program there, right? We need those organizations all involved, making sure people get connected, because veterans do need a specialized touch. And when you talk about specialized population, that's where VIA sees our niche in this market. We're not a Walmart of the world where we can just one size fits all. We're about really looking at what are some real specialized populations that really need unique solutions to help support their care. And that's where our partnership with NC Serves comes in. We're excited about that. NC Serves has done some incredible work partnering and engaging veterans and getting them connected. And so we really just want to come alongside them and really provide as much support we can to them so they can continue the really incredible work and to make sure that we continue to support veterans as we continue to transform this system around us. And so that's really where we come in. We help manage the money, we help manage the resources, but also provide some strategic overview to the team to say, okay, these are the changes that are coming down the pike. How do we stay 3 steps ahead of that in the system and make sure that the system that we're developing here is cutting edge? And we can say North Carolina isn't first in flight or first in forestry, but overall best in veteran services. And so that's our goal at VIA and why we really want to be part of this team. So thank you.
Absolutely, I appreciate that, Donald. And likewise with Governor's Institute taking an active role in NC Serves as well. So the GI is, as you saw, pretty deeply rooted from the GWG video in some of these veteran services. Now with this transition to local ownership, we have an opportunity to provide some research and insight to those on the ground doing the work, manage what we call the community of practice, and that is this cyclical nature of performance feeding insight, insight feeding performance, and propelling the work forward. So GI is incredibly excited about all this. I shared this with our board of directors recently, and they were all very receptive and congratulatory, and I think that this is going to be a wonderful partnership. So let's dive into to the folks that have to do the real work. VBH and VSC, and Blake, I believe you are up first, sir.
Thanks, Dave. Yeah, just wanted to give a snapshot. We've been a part of the Governor's Working Group from when Lario and Jeff were both at NCDMVA. So we are honored to be a part of it and continue this work. And as was mentioned earlier, NC Serves kicked off in Charlotte in the Metrolina market. We were that first quarterback 5 years ago. Amazingly, it's been 5.5 years since we launched, and just really very humbled by the experience. We've had some amazing partners, and I would be remiss if I did not recognize IBMF, Syracuse University, Walmart, and all of the funders that helped us get to this point. They believed in this state, they saw the opportunity, and they knew that we had the right pieces, and that we were all working together already. We just needed some tools to help amplify and accelerate that impact. So grateful for what they've done, and grateful that they've entrusted us with this responsibility moving forward. And to work with folks like Dave and the Governor's Institute, Brandon, of course, you can't ask for a better peer coordination center leader. And then to have that strategic guidance and support from VIA and Donald is really phenomenal. So what we'd like to announce, that is probably the world's worst kept secret, is we've expanded beyond Charlotte, and thanks to the fantastic leadership and facilitation from the USO of North Carolina, their team has recently come over and joined the VBH team. And so the central market and Metrolina markets are intact, same people doing the same great work with the same fantastic partners every single day. The only difference is their email addresses have changed. Their higher headquarters has moved over here to Veterans Bridge Home. So I've listed those out. The first couple names are our Charlotte team at Veterans Bridge Home, historically, and then Sergeant Major Paul Berry, Rebecca Swain, Michelle Bula, Chris Brown, and Jessica Salinas are all still on board at the central team. So collectively, we're covering down on that blue part of the map, as you can see there, with the 4 major metro areas in the center of the state. And we also are about to hire two new roles, one in Raleigh and one in Fayetteville. So more information to come on that. But we're very excited to be able to grow the capacity of the team, and very excited for 2021. I want to just wrap up and say, this doesn't happen without fantastic partners. We can't do this work without nonprofits that are delivering the care in every different facet, on every different service area for our veterans. So if you know folks that are on that map that would like to, be a part of the network, or if you'd like to, get some more training, reach out to me or anyone that's listed on this slide, and we'd be happy to do that. And I want to thank Crystal and Jeff for putting together another great Governor's Working Group and supporting us where IVMF and Walmart and Levine Foundation left off with their leadership. Jeff Smith, Dr. Laws, and the entire team at NCDHHS have stepped up and allowed us to continue this work, and we're very grateful. So whatever your team needs, whatever your veterans need, just let us know, and we're happy to be a part of this. Thanks.
Thank you very much. Brandon, we'll go over to you for VSC.
All right, I'm not going to sort of echo a little bit about what Blake said, but definitely want to really talk about the support DHHS has given to us, the opportunity IVMF had, and the vision that they've had, but then more importantly, where we're at now in the current state and where we're going. And I think that's really important. And when you look at the map that Blake had, and then you look at the map that I've got right there, you sort of look at that, and what we've done is we've used each other's strengths and talents so we can better our skill set for our veterans. And what I mean by that is Blake and his team have done a remarkable job, and we all know that there's a lot of difference in supporting veterans in a metro environment, in an urban environment versus the rural environment. And Blake and his team has been proven that they can do this work in the middle part of the state and in the major cities. And hopefully we've done a really good job with our team doing that in the more rural areas. And so we've harnessed each other's strength, and we've sort of Oreoed the state to lean on that so we can continue to grow collectively as a team. But we also know there are some unique differences in some of those populations that we're serving from rural to metro areas. And so we're really looking forward to working really close with Veterans Bridge Home, much like we have been, to learn a little bit better of how they're doing their work versus how we're doing our work. And I think we're just going to make each other sharper as we move forward. You can see what makes veteran services of the Carolinas a little different is we do offer a lot of different other programs as well that are direct services. We offer SSVF housing, we offer employment with our HVRP program, our Hope Outreach, and then obviously our SERVs. And so we're hoping that bandaging that together and weaving that in and out, and that blended funding allows us to be better for the community, better for our veterans. We were very fortunate. ESHA, East Carolina Human Services, was really grateful to us and allowed us to get Mr. Tim Driscoll over from their team onto our team now. And he's doing really good things down in the Jacksonville area and the Wilmington area. And our team that you see there, Hunter Russ is our assistant director. You'll be hearing from her this year. And then you can see Brandon Davis is our senior care coordinator, Sheridan Lewis, Jen Melton, Jason Cole, Jesse Hill, and Patrick Barton. And then Rochelle is our marketing person. So we are at capacity right now, but we always look to grow and scale that. We have a lot of work interns that come on board. We're just really fortunate and grateful to be in this space, and thank Jeff and Dr. Laws for still continuing this mission, giving us the opportunity to do this work. With that being said, Dave, I'm going to yield back my time to you. And thanks everybody on the call. Thanks to all the chairs, and welcome Secretary Gaskin.
Right, thank you, sir. So yeah, you see NC Serves kind of taking on a little bit of a different face. More, it's really about getting the right butts in the right seats. And so there's a lot to be excited about in 2021. Together via VSC and VBH and GI have determined a handful of areas that we really want to focus on in 2021. Starting with growth. So there's always room to grow in this space, and recognizing that we've set a target goal of increasing the number of providers using NC Serves by 5%. So that's roughly 20 providers across the state. We think that's within reach and really allows for steady and responsible growth. We're always looking to improve the core business of NC Serves, right? And that's getting the right person to the right provider at the right time they need it. And so we'll continue to find ways to shorten the time from flash to bang for the clients. For reference, our current median time to match is about 2 days, which is good, but can always be better. And Blake and Brandon and Donald, by the way, please feel free to chime in on any of these if you want to add something. So given that we have some 400 providers throughout the state, they're out serving veterans, service members, military families every day. We feel like there's a unique opportunity here to push the conversation about disparities in health outcomes for historically marginalized populations. That we don't want to see a single person that has served their country experience anything other than the highest possible health, wellness, financial outcomes. And so over the course of this year, the NC Serves Community of Practice is planning to work to understand health disparities and work with our veteran community to overcome those. We've already begun to incorporate this thinking and approach into grant applications and future plans. And this is a big fight. It's a big task, but I think it's the one that we can win together. Finally, we are working alongside our friends at Unite Us to fully integrate the network into NC Care 360 this year. As NC Care 360 is the state's platform of record, so to speak. And I'll ask Donald to say a little bit more about that on the next slide. But I think it's safe to say that we don't yet have every detail hammered down in place, but we have prioritized this integration as something that's very important for both networks. So again, Care 360, we'll see if my video will play here.
I'm particularly proud to have NC Care 360 in all 100 counties of North Carolina as of this June. This is the nation's first statewide platform that bridges healthcare and human services, and I know NC Care 360 is going to be a great new resource for veterans and for all North Carolinians. In fact, the development of NC Care 360 was pioneered through NC Serves, that care coordination networks that's used for veterans and families, and it was supported by our Division of Mental Health Services. So both NC Care 360 and NC Serves are powered by the Unite Us platform. We're currently working to merge those networks and databases together to better support the care of veterans in a coordinated model, which over the past 6 years has assisted with 16,000 U.S. veterans and family members and with over 40,000 individual assistance needs.
Excellent. So Donald, if I could throw it over to you, talk a little bit about where we are on the transition, what we expect to see this year.
Yeah, thanks, Dave. I think Secretary Cohen, hit the nail on the head there, is that this platform, NC Cares 360, which is an incredible platform for citizens of North Carolina, was built on the foundation of NC Serves and the work that Blake and Brandon has done through the NC Serves developing those systems and just showing how successful it has been in a system. I think the challenge now for us is the integration of this new platform into the existing work that we're doing to make sure that veterans continue to get the specialized support that they need across the systems. And so one of the great things is that via Health and with NC Serves, we're also at the table with Unite Us, and we're having these conversations regularly with Unite Us that as NC Cares 360 rolls out, what are the right questions to be asked Jeff mentioned, ask the question campaign. That really needs to be embedded into NC Cares 360, right? That question needs to be asked right at the forefront. Have you or any of your loved ones ever served in the military? That's important, right? And so embedding that into that conversation, getting that worked out before the rollout of NC Cares 360, it's already rolling down the street, right, in use and starting to be used across North Carolina, but continuing to be at the table to talk about how we can continue to support that and making sure that we can continue to get the right data out of those platforms so we can adequately assess where are we doing a good job and where do we need to make improvements. That's vital for us to know where in North Carolina we're having successes and where we're not, so we can really focus our resources on those areas of North Carolina and those veterans in North Carolina where they're not able to access the supports they need. And so if we don't really mold this carefully along the way, we may lose the ability to identify those individuals in the system, which makes us a bit blind to our veterans' needs out there. And that's exactly what we don't want to happen. And we're really working together as a team to assure that that doesn't happen. And so we're confident that we're going to do it. And hopefully by our next report out, we'll have some more details on you on what that's going to look like.
Brandon, anything to add?
No, I do. I would be amiss if I did not really thank Steph Young. I'm so glad she's a chair now on this committee of the governor's working group. But her leadership and vision in this space has been really great, and for the success of our NC Serves Western. We've got some really cool projects going on with the Asheville VA Medical Center and the housing department and the social work department that she has really leaned into this work and spearheaded this work, and is currently the only VA medical center in the state, Asheville is. And so really grateful for Steph Young and her vision, and I'm so glad she's a part of this larger conversation now at the vision level. So.
Blake.
The one thing I'll add is, I think we should take a moment and be proud and recognize that our veterans were the first through the door on this one, right? Unitas stepped up. A lot of good folks stepped into this fight and said, hey, we can care for, not only can we care for North Carolinians, let's do it with veterans and military families first. Let's learn from that. And it's really carried us this far in 5 years. So doesn't mean the mission's over, doesn't mean we need to stop, but it does mean we should recognize that. And it's should be no surprise anyone that lives in North Carolina that we can expect that from our veterans.
Yeah, absolutely. I appreciate that. And, I think that what you heard in there was really the point of the governor's working group. And that's collaboration. That's crosswalking these activities with each other, with the understanding that there's no silver bullet that's gonna solve these issues on their own. So incredibly important, incredibly exciting to be able to come alongside a part of the NC Care 360 network, and just allows us to reach more veterans. Blake mentioned that there's a lot to be proud of, and there is. So we've now passed 17,000 unique clients since this started in August 2015. And those 17,000 clients have made 41,000, almost 42,000 service requests. So that's a good thing, that we have people that are coming in asking for one thing, understanding that it's interrelated with another, maybe housing and shelter and employment that kind of co-occur with each other, or income support and rent support, food instability. And so the networks are doing what they should in terms of making additional services and related services available to the clients. We're just over 400 participating organizations, going strong and still growing. We can't say enough how important it is that the providers as the point of service are almost the most important part of this initiative. Housing and shelter is a request that we see most often. That's been the case really since the start of NC Serves. Most of who we do see are veterans and service members. That's 82%. But we can't forget that there is an incredibly important little orange 9% right there for spouses and caregivers. You know, we could talk all day about the important role that that these folks play in the health and welfare of our veterans. But it's something not to be overlooked, and something that we certainly pay close attention to. So with the transition to local ownership, now more than ever, it's important to remind ourselves that NC Serves is all of our network. It's right. It's all of our tool to improve the way we serve veterans. That said, we're challenging everyone here in the state to engage with the network. There have been a lot of opportunity. There are a lot of opportunities to really, you know, blow this work up. I'll specifically mention, and it's a little bit of a challenge. Martin Falls, please go easy on me, but our state service officers, our county service officers, Martin and Crystal have been, you know, big promoters of this platform, and you know, together we want to continue that work. But there's so much more meat left on the bone in terms of what this can do for veteran service officers as that kind of fulcrum or pivot point where they see the majority of the veterans in the state. And finally, that for me, that's it. Thank you very much. There's contact information if you want to get a hold of your nearest center, and I'll send it around one more time to Donald, Blake, and Brandon to sign off. So Donald.
Just thanks again for allowing me to be part of the project, and for allowing VIA Health to sort of lead part of this charge of supporting veterans across North Carolina. So I'll leave you with that. We look forward to our next report out, where hopefully we have even greater things to say. So thank you.
Blake, we'll go to you.
Yeah, hey Dave, back up 2 slides for me real quick to the data.
Sure will. There you go.
I know we're preaching to the choir here, but if I look at 5.5 years and 17,000 unique clients, that's only 2.4% of the total veteran population. Everybody on this call knows that more than 2.4% of the veteran population that's raised their hand and has needed some service that we haven't tracked, that we don't have written down, that we can inform our leaders at the state and federal level on how we make a difference. And that #1 requested service is a big one. We can't get housing sorted out if we don't have all the information. So my action, my call to action or ask of everybody on this call would be, we got to use this tool. We've been gifted with this tool. Let's do that and work together. I had a battalion commander in the infantry that told me, Blake, if you're going to be a good leader, you got to do 3 things. You got to care, you got to have your facts straight, and you got to be consistent. Right now, we're at an intersection of a suicide epidemic, a COVID pandemic, and Medicaid transformation. If you can't show that we care about that suicide epidemic and the impacts and ripple effects of the COVID pandemic, then we shouldn't be in this work. If we don't do and track the work that we're actually doing and showing that we care, then we can't inform leaders on the gaps and the things we're missing, as Donald mentioned. And the last piece is, we've got to do it consistently. A lot of changes, a lot of progress, a lot of opportunities with NC Care 360 and Medicaid transformation. But if we don't do this seamlessly and together in a collaborative approach, as Dave said, then our veterans will drop through the cracks and they won't get the care they need. So it's an opportunity to care, to have our facts straight, and to do it in a consistent team-based environment. Excited to do this, move forward, and I hope everyone else will join us. Thanks.
Brandon, close us out.
No, a lot's been said here, and I know a lot of us have been on this call, but really my call to action is the same thing. A lot of the teams across the state, we're doing this work. And so we want to highlight the great work that you are doing in the community. You may help 10, 12 veterans a day, 20 veterans a day, or one veteran this weekend. What we want to do is capture that great work for you and highlight that great work to set you up more for success, to set your community up with more resources. And I think that's really what we want to do here. We can't do this work alone. We got to do this work side by side and in alignment. And I think we're in a really good position in 2021 to do that kind of work together. And that's what we're trying to do here, is just bring everybody in alignment and highlight the great work each one of our organizations are doing across the state. So really grateful for the opportunity again, and grateful to see what this year is going to bring.
Absolutely. Thank you. And Crystal, we'll throw it back to you.
Thank you all for that wonderful information. I just want to piggyback on what they said. The North Carolina Department of Military and Veterans Affairs, our VSOs, play a key role in getting these veterans connected. So I'll challenge all of the veteran service officers out there to make sure you ask more questions than just about benefits eligibility. The Governor's Working Group, Veteran Support Specialist Program, Veteran Services of the Carolinas, NC Serves, all aim to give our service members, veterans, and their families a better quality of life through benefits, employment, housing, food security, utilities assistance, social enrichment. All of these things are known as upstream interventions, and they all support our state suicide prevention program by helping those veterans, service members, veterans, and families out there from getting to a point of feeling hopeless and like there's no hope for them. So please, please engage with these, our partners. And I will now introduce Suzanne Thompson with the Department of Health and Human Services, talking about vaccine training and inoculation. Suzanne, welcome.
Thank you for having me today. I appreciate the opportunity to give you all some information on the department's vaccine rollout. Alex, I'm not sure if that's going to go slide to slide, but I think you might just have to roll it. Yeah. So the good news is that everybody will have an opportunity to have a vaccine. It's just going to take some time, given the amount of available vaccines that there are right now. Next slide. So we know that there's been a lot of effort made in North Carolina and nationally to make sure that we touch the historically marginalized populations and that we really educate them on the vaccine so that they are not afraid to take it. We've heard, especially in the Latinx population, that there's a lot of fear about getting the vaccine. So we are working very hard to reach out to those populations, and we would actually ask for your help in doing more additional reach out. Next slide, please. So this vaccine, I know everybody thinks it's really rushed because it was less than a year by the time the vaccine came out, but there is literally a lot of time and effort and past research that went into developing this vaccine. A lot of volunteers in the clinical trials. Supplies are limited right now, but you definitely will have a spot to take your shot. Next slide. So the scientists, when they started working on this, they had a lot of historical data because this vaccine is very similar in nature, and this virus is very similar in nature to the SARS-2 virus. So a lot of the data was there, a lot of the research. So that was what made it a lot quicker to have this one on the market. They just built on similar viruses, similar research, similar data. Next slide. In a normal vaccine trial, there's about 2,000 people that participate in the trial. There was more than 70,000 volunteers for Pfizer and Moderna to determine the safety and the effectiveness of the vaccine. To date, both of these vaccines are 95% effective. There have been no serious safety concerns with any of the vaccines. People symptoms afterwards are sore arm, headache, feeling tired, achy for a day or two, but it really goes away really quickly. Next slide. Both of these manufacturers made an intentional effort to recruit people from the historically marginalized populations. You can see we still have work to do, but the breakdown is much better than it has been in previous trials and clinical research studies. And part of the reason that they did touch so many more people and the breakout isn't quite as bad as it normally is that they literally involved so many more people in the trials. So next slide. You cannot get COVID from either one of the vaccines. They are made from antibodies, but they are not made with live virus. So the antibodies work to break down and fight off the virus, but they do not cause the virus. Next slide. So with both the Pfizer and the Moderna shot, you need to have 2 vaccines. For Pfizer, the vaccines should be 3 weeks apart. For Moderna, they should be 4 weeks apart. It is important to get both doses to be the same vaccine. So if you have Pfizer the first time, you should get Pfizer the second time. Wherever you get your first shot is where you should get your second shot. Shouldn't have to go to different vaccine sites to get both shots. Next slide. So as of last week, 14.2 million Americans received their first dose. There are many people that have actually received their second dose. So we are making headway nationally and in the state, but it just really is going to take time. Next slide. This is really a good quote from Representative Willingham, that he wants to be around for his grandkids. So the sooner he could get vaccinated and the better off he would be. Now, getting vaccinated doesn't mean that you don't wear your masks. So we still have to, practice the 3 W's, the wear your mask, the social distancing, and the way washing your hands. So next slide. There is nothing in the vaccine that can be tracked. There are some people have said and heard that there's proteins in your body that allow it to be tracked. It's not true. No personal information is collected or shared. We don't send any personal information to the CDC or to the manufacturers. We just send numbers and data. So there will not be any personal information shared with anybody other than your actual medical provider. And that information is like all your medical records. It's protected by HIPAA. Next slide. The vaccines are available to everybody. They are free. The cost is covered by the federal government. There is no copay, even if you have insurance. The supplies are limited. Right now, the manufacturers are working as hard as they can to make additional vaccines. The federal government is purchasing them in larger numbers, and every week the state gets an allocation. So next slide. So yeah, that one. So currently this is the rollout, and we are actively working on groups 1 and 2. Groups 1 is the healthcare workers and long-term care staff and residents. And group 2 is anybody over the age of 65. So our goal is to move through the phases as quickly as possible, just based on the number of vaccines that we get allocated. The next group of workers will be your frontline essential workers, which is your grocery store workers, your police officers, your anybody that works in the direct public, firefighters, teachers, childcare workers, and we will move to those next groups as quickly as possible based on the allocation of vaccines. Next slide. So this is just a different layout of who's currently being vaccinated right now. But if you are in one of those two groups and you want to know where to go to get your shot, there are two ways you can do it. One, you can call the vaccine line at 877-490-6642, or you can go to the yourshot.nc.gov website, and there is a listing by county with a that tells you who in the county is given the vaccine and what the number is, so that you can contact them and get your appointment scheduled. Next slide. So every week, North Carolina learns how many vaccines they're going to get from the federal government. And so once the state learns how many we're going to get, they will prioritize the doses based on population. And then what the state will do is notify the manufacturers on where to ship the vaccines. So for example, if you're in Wake County, they will tell them to ship them to Wake County Public Health, or they will tell them to ship them to UNC Hospital System, and the providers will store and handle the vaccines. And then people in the state will go through the websites to get the numbers of the person in their area that's giving the vaccines and make an appointment. Next slide. So literally healthcare workers, first place to start is talk to your employer about where your spot is and where you are getting them. For long-term care residents and the staff, there was two options for long-term care facilities: one, to register through the state, and two, to register through CVS or the federal government for the CVS and Walgreens distribution. So long-term care facilities that registered through the federal government for CVS or Walgreens vaccines, then those facilities made arrangements with whoever they were assigned to come out to their facility and get their staff and residents vaccinated. For those that are 65 or older, the recommendation is to contact your local health department or the hospital in your area to make an appointment. They are starting throughout the state to have larger vaccine points. Like this weekend in Charlotte, Atrium Health is using Panther Stadium, Bank of America Stadium, as a vaccine distribution center. It is by appointment only, but they do have appointments. So there are large vaccination events happening all over the state. Next slide. What's really important for everybody to remember is that the state is really working as fast as we can to get the shots to the people. We are doing everything we can with getting the information out there. The secretary is doing her regular updates on television. We have the website, we have social media. We have asked providers, community leaders, community organizations to help us share the information so that we can really get the information in the hands of the people that need it, which is where to go to get your vaccines and how to find out when your turn is. And on the Your Spot, Your Shot website, there is also a thing where you can check to see which group that you fall in, which of the 5 groups. Next slide. This is just an example of some of the professional organizations that are encouraging Americans to get vaccinated. And so we ask you to encourage all of your members, your veterans, your friends, your families to get vaccinated when it's their turn. Next slide. This is just a example of the resources that are available on our website. We have a one-page flyer. We have a frequently asked questions document. There's several PSA announcements that can be shared. The slide deck is updated at least once a week. It's available for download off of the public website. You can share the slide deck or any of these resources with anybody in the community. So we ask that you help us by sharing this information widely. Next slide. And just because people are starting to we have more and more people vaccinated does not mean that you stop practicing the 3 W's. Wear your mask, wait 6 feet apart, wash your hands. It is still crucial to continue to practice these 3 W's as we move through this. Next slide. And this again shows you the links to the slide deck, the tip sheet, the other thing that's on here is a link where we're asking that people upload selfies or videos when it's their turn and they do get vaccinated. So there is a link there with directions on how to do that. And next slide. So that's the basic information that I have for you on the vaccine rollout in North Carolina. And I will be happy to answer questions that I can answer. And if I don't have the answer to questions that you might have, I will do my best to get you answers.
Hey, Suzanne, this is Cherry Westbrook at DMVA headquarters in Raleigh.
Sure.
The question I have is, do the VA medical centers get their vaccine distribution from North Carolina, or do they get it directly from the federal government? And as such, are you guys tracking what the VAMC is doing to the veterans that is in addition to what's going on everywhere else in the state?
I don't know the answer to that, but I will find out and get back to you.
Okay, so I mean, that'd be interesting to know if North Carolina, because our veteran community, that's what we're really talking about here. So we'd like to be able to give them that information.
Yeah, and the other thing too is I know a lot of them do go through the VA, but they don't have to. They can literally go through their local health department. If they are a healthcare worker right now, or they are 65 or above, they can go through the same process that everybody else is in the state. They're not required to go to the VA to get the shot.
Hey, this is Stephanie. Dr. Parker is on the call for the VA, and she can provide additional information when she does her piece if you so desire. Thank you.
Well, thank you for giving me the opportunity to give you this information. And if you have any additional questions, you can just have Jeff get in touch with me and I'll get you the answers.
Thank you so much, Suzanne.
You're welcome.
Thank you, Suzanne. We appreciate everything that you do. I, for one, support the vaccine. I'm looking forward to getting it. And until then, I'm going to stay right here. Let me get up to speed. And next up, we are going to have Dr. Mary Parker with the Veterans Healthcare Administration. While I am getting to her slides, John Baker, if you are still watching with North Carolina Department of Health and Human Services Hearing Services Division, I am going to get in touch with you so that we can get a message out to all our veteran service officers about the services you have for our veterans with hearing loss that might not be eligible for VA health care. And so we can help them through the Department of Health and Human Services. Thank you for being on today. Dr. Mary Parker, I will turn it over to you. Welcome.
Thank you, Ms. Miller. Good afternoon, everyone. I appreciate the opportunity and the invitation to speak with you today regarding the COVID-19 vaccine updates on behalf of our vaccine team. We have been working diligently with our federal partners over the past 7 months to prepare for and initiate vaccine rollout. Next slide, please. Everyone on this call is very familiar with our catchment area. One of the things I always forget about is that Virginia Link is so important because of the Elizabeth City Clinic, which due to proximity ties to our Hampton VA mother facility. But we are grateful for the opportunity to serve over 400,000 veterans in North Carolina and Virginia through our 7 major medical centers in the 2 states, our 38 healthcare centers, as well as a number of our community-based outpatient clinics. Next slide. Oh, there we go. Thank you. So to answer the very well-timed question, I wish that I could say I had planned, your timing was impeccable, but separate from the state allocations, CDC and what has been known as Operation Warp Speed has been providing weekly allotments to the VA healthcare systems across our country since December 15th. In North Carolina and Virginia, we received our first allocations within 7 days of the initial approval of the Pfizer vaccine product mid-December of last year. Since that time, we have continued to receive weekly allotments, again, separate and in addition to those allotments described by our previous speaker, to the tune of over 800,000 first doses throughout the country since mid-December. Last week, our allocation nationally was just a bit over 100,000 first doses. We have continued to sequester our second doses at this point in time. And those weekly allocation totals have been fairly stable over the past month. We are excited to see a little bit more supply next week and are very hopeful that that will continue for the weeks and months to come. Our national allotment is distributed across each of the regional networks and is also varied based on the number of veterans in a particular area, as well as other measures such as the operational capacity. We were asked to very quickly and efficiently prepare to administer nationally 100,000 doses a day. And we do not yet have supply to do that. However, we do have the infrastructure and the teams in place that as we continue to see the additional allocations come from these manufacturers and others that join in this provisioning, we anticipate that we will be able to meet our country's need and assist with getting vaccine out just as quickly and efficiently as possible. Now, let's talk about North Carolina and Virginia veterans specifically. To date, we have vaccinated first doses. We've provided those to more than 43,000 veterans in North Carolina and Virginia. And our allocation of doses so far represents approximately 5% of the overall VA allocation. We are very fortunate as we continue to grow our veteran population, as we are known as very veteran-centric, that we are receiving as much vaccine, certainly not as much as I would be happy with, but we are receiving as much vaccine as possible, and we have been able to demonstrate that we are getting it in arms so that we are able to get additional allotments in the weeks and months to come. Next slide. So nationally, how do we compare? So you'll see that of the national doses that have been provided, we are working diligently. And one of the things that it's important to point out is there are a few differences, and that's something we can certainly sit around and talk about. But in general, I've been really glad that the CDC proposed phases of vaccination in general have aligned with many of the state components. But as of today, in our VISN 6 population, we are working to complete our essential workers, our frontline workers vaccines, and our high-risk veterans. We've actually been able to expand at most of our facilities. We've gotten adequate supply that those over 75 and our next priority groups, that includes our homeless veterans, those who are over the age of 65 with conditions that put them at higher risk to develop a more significant bad outcome from COVID. Those are folks that we are now able to offer a vaccine to. And so we call that our phase 1C. And across our catchment area, we have a series of large vaccine activities. Now, I'm going to say they're not as big as Atrium did at the racetrack last over the past several days, or what's planned for Panther Stadium. However, you know, we have 1,000 vaccines that will be administered in our Salisbury area this upcoming weekend. The following weekend, we have 3,000 vaccines planned in our Durham areas. So we are working to make sure that our throughput, if we get 1,000 vaccines in a week, and that's what we can be allotted based on the national allotment, we're going to give 1,000 doses. And then we're going to make sure that we get those second doses in arms just as timely. The final point I'll add, which is actually in addition to what's on the slide, one of the things I'm most proud of is the focus that we have had on the safety of those veterans that are entrusted to us in our community living centers and our group congregate living settings. I'm so pleased to report that we have had a wonderful adoption of vaccine in that population. We were able to get those in many first doses prior to the end of 2020. And that is something that that's an area where we lead the nation. Next slide. So for our veterans who are interested in joining or moving forward with vaccine, if they are currently cared for within the VA systems, they can reach to their primary care teams. And we are actively scheduling across all of our sites of care. You see before you the list of our 7 medical centers, 5 of our HCCs, and 3 sets of our CBOCs, community-based outpatient clinics, where we currently have vaccine. We are working to add vaccine at Jacksonville. And again, we are, as quickly as we get additional vaccine supply, we will be moving to increase that turnover and getting that vaccine out into all the component areas that we are privileged to serve. We are contacting veterans through text, through telephone, through outreach tools, and we'll continue to provide both walk-in clinics as well as drive-through opportunities at our various sites. And we are also working to finalize our provision to caregivers through our formalized caregiver programs. So all in all, as quickly, you know, the mantra in our office, we've got to give vaccine in order to get vaccine, and we are working to get every single dose possible into arms so that we can get as many veterans and caregivers vaccinated as possible, and we can continue to support our efforts across North Carolina and Virginia, and DIMPS our services nationally. So with that, I believe that was my last slide. I'm thrilled to take any questions that you have. And I, again, appreciate the warm welcome and the opportunity to share our rollout plans with you all today. Thank you.
Thank you so much. I do have one question, and that is what high-risk conditions list is the VA using?
Great question. We are currently following, it's closest to the CDC listing. It does not align 100% with the North Carolina list, but the CDC guidance, and I'm happy if someone would like if somebody can send an email address, I will be happy to provide if there's a specific condition to assist with that. In general, it's those high-risk conditions that we are all familiar with, our diabetics, our immunocompromised individuals, and the age category. We have some great tools for those veterans that we get to care for that's really making it easy for us to provide direct outreach. There are many who are choosing to enroll, and that has a separate opportunity associated with it.
Thank you. Are there any other questions?
Crystal, I just want to add real fast, Dr. Parker, thank you for all your efforts. I know that our local VA worked really close with our restoration quarters in Asheville to get them all vaccinated. And so I really appreciate extending that service into our residential facility for veterans. So thank you.
Thank you so much. I will very happily pass that along. I cannot say how wonderful this team is that is leading this charge. Our pharmacy executive, our vaccine coordinators at each of our sites. You know, this is one of those things that we hope we never have to experience, but wow, what an amazing group that does exactly right and puts our veterans first and gets the job done. I could not be more proud to serve with this group. Thank you for that.
Dr. Parker.
Hi.
Hi, good afternoon. This is Martin Falls, Department of Military and Veteran Affairs. A couple of things I'd like to say. Thank you for being here today to explain this to the veterans. You know, we have a broadcast here that goes out to thousands and tens of thousands of veterans and supports and nonprofits, but thank you for that today, and for staff as well, supporting our veteran nursing homes in the state of North Carolina. Top priority, and we have all those completed. But thank you very much, and look forward to our continued collaboration and efforts together to take care of our veterans in the state of North Carolina. And we'll be in touch with you tomorrow.
That sounds perfect. We've been very fortunate with many of our state facilities that the partnership with CVS Walgreens has been so effective. And I believe it was you or a colleague in your room that said that all the state veteran facilities had received vaccine, and that was a big checkbox over here that I got to put a big check in. So you have made my day. Thank you.
Yes, Dr. Parker, and just to follow on, 2 of the 4 veterans homes have already completed their second clinic, and the other 2 have completed their first clinic and have their second one scheduled. We'll have a 3rd home next week. We're at about 80% of the residents in our homes have received at least their first dose. So we really are appreciative of all the work that the Division 6 has put in this coordination with CVS and how it's worked out for us. Our guys have done well, and our healthcare workers are starting to drop in there too now. So we're getting a better turnout for them now also.
And I'm so pleased to hear that. I just can't say enough. As we get additional exposure and get additional numbers vaccinated, I truly believe we will see additional throughput, and we will get many who have, there's this whole discussion about vaccine latency or vaccine concern, and the best way that we can move that forward is and eliminate it is by talking through it and figuring out how we can help people feel more comfortable. Great job.
All right. Thank you so much, Dr. Parker. We appreciate you so much. One big takeaway from the Governor's Working Group is you're going to hear good news. You're going to hear good, feel-good stories. I want to say thank you so much to Secretary Gaskin for joining us today. I hope to see you at as many meetings as possible. I know your schedule is going to be very tight throughout the year, but we really appreciate you being with us. Thank you to all the co-chairs who presented today. Thank you, John Camp and team, for that awesome NC Prevents video. Thank you, Jeff Smith, for all you do to make sure that we are on. Thank you, Governor's Institute. I could go on and on. We appreciate Suzanne Thompson and Dr. Parker for being with us today. And please share our presentation, share on your Facebook page, share the YouTube link, get this information out to those who need it. We have to engage each other. We have to work with NC Serves and Veteran Services of the Carolinas, who will be hosting some drive-through stand-down events in the spring, and who hope that we will be able to do some clinics for the vaccination there. So hopefully we can get some veterans identified and vaccinated through those. We will have that schedule up on our website so that you all will know when those are happening and what part of the state they're happening in. Does anyone have any final thoughts for today before we close? All right, if not, our next meeting is Thursday, February the 25th. We will be discussing pandemic housing issues, food, and employment resources, all exceptionally important right now during this time. There are a lot of people who are facing eviction and homelessness. There are people without food, and there are people without employment. So please join us in February so that we can help get out the information that can help those individuals find resources. If there is nothing else, again, register for email updates at ncgwg.org. Remember to like Governor's Institute page so you'll be notified when they're going live. And our meeting agenda and minutes are always at ncgwg.org, minutes and group updates. Thank you again, everyone. I hope you have an excellent afternoon and a good weekend coming up. Bye-bye.